All right, good morning, good afternoon, good evening, depending on where you're located. I'm Dr. Corey Brown, Doctor of Acupuncture and Chinese Medicine, and I will be talking to you about a systematic review for the treatment of epilepsy in Western and traditional Chinese medicine. We have an outline here where I'll be going through the introduction, the understanding of epilepsy, limitations of conventional treatments, principles of traditional Chinese medicine, acupuncture and epilepsy management, Chinese herbal medicine for epilepsy, integrative approaches, research evidence and methodology, challenges and future directions, conclusion and implications. So as we get into the introduction, talking about the complex challenges, epilepsy affects 65 million individuals globally, with 1 in 26 in the US. Conventional anti-epileptic drugs offer control for many, but fail in 30% of patients, leading to intractable epilepsy, which I'll explain later what that means. Adverse effects of anti-epileptic drugs are substantial, affecting mental, cognitive, and behavioral health. Significant adverse effects and limited efficacy of anti-epileptic drugs drive the search for better treatment options. Traditional Chinese medicine offers a holistic approach, but clinical trial support is limited. Conventional treatments focused on seizure type. TCM uses a broader classification called Xinjiang, which may limit tailored strategies. TCM views seizures as caused by imbalances like internal wind and phlegm. Acupuncture, alongside Western medicine, has shown promise in enhancing quality of life and reducing seizure frequency. There is a need for robust trials to validate the efficacy of TCM and acupuncture, addressing gaps in current literature. Okay, so understanding epilepsy. Epilepsy is a chronic neurological disorder characterized by recurrent unprovoked seizures. Seizures are episodes of abnormal electrical activity in the brain, not all indicative of epilepsy. So it's common that seizures get tied into a person automatically having epilepsy, but not all seizures are caused by epilepsy. Epilepsy affects all ages, genders, and ethnicities, significant impact on all aspects of life. It affects 1 in 26 people in the US and over 65 million worldwide. The International League Against Epilepsy classification classifies seizures as different types, different epilepsy types, and epilepsy syndromes. Categories for seizures are focal, which is one side of the brain being affected, generalized, which is both sides of the brain being affected, and unknown cause. The importance of identifying the underlying cause is based on structural, genetic, infectious, metabolic, and immune factors. As far as the impact on the individual, it affects the emotional, behavioral, and neurological aspects, which causes challenges. There's social stigma and discrimination also. The primary treatment for epilepsy are anti-epileptic drugs, which are effective for up to 70% of cases. Intractable epilepsy affects about 30%, which means that these are individuals where their epilepsy can't be controlled by conventional medication. Adverse effects of anti-epileptic drugs are cognitive behavioral issues, risk of depression, and suicidal ideation. There's also a need for affordable and accessible treatment options, and there's importance of considering both efficacy and adverse effects of treatment choices. So the limitations of conventional treatments. Conventional anti-epileptic drugs is kind of like a double-edged sword because sometimes they work for some and then some they don't. Anti-epileptic drugs are key in managing seizures and enhancing quality of life. The mechanism of most anti-epileptic drugs, they target ion channels or neurotransmitters like GABA. And these are some examples of those drugs. So as far as adverse effects of anti-epileptic drugs, there's the cognitive effects, which affect memory, attention, and cognitive processing, which can be impaired. There's a risk of depression, behavioral changes, and suicidal thoughts. There's also physical side effects such as headaches, ataxia, allergic reactions impacting central nervous system and other systems. And as far as drug-resistant epilepsy, about 35% of individuals do not respond fully to anti-epileptic drugs, requiring alternative treatments. And then there's also a focus of developing new anti-epileptic drugs, like the ones listed here, currently for drug-resistant epilepsy. And then there's some complex etiologies, such as genetic, environmental, neurobiological factors, which contribute to drug-resistant epilepsy. As far as comorbidities and quality of life, once again, there's depression, suicidal thoughts, ADHD, hepatic, and renal diseases, which are associated conditions. And then as far as supervision, there's this emphasizes the need for medical oversight and anti-epileptic drug administration to constantly monitor the patient and how they're responding. And then there's a call for alternative therapies. So their limitation and side effects underscore the need to explore other options like TCM. So the principle of traditional Chinese medicine. So the philosophy is about balance and harmony in the yin and yang theory. So opposing yet complementary, forcing and maintaining equilibrium for health. And then there's the qi, which is the vital energy or life force flowing through the meridians, fundamental for well-being. And then as far as disharmony, that's what epilepsy is looked at as a harmony disrupted. Epilepsy and TCM is a manifestation of internal wind and phlegm disrupting the yin and yang balance. Internal wind is associated with involuntary movements caused by heat, phlegm, or deficiency. Phlegm leads to control loss and consciousness disturbances, which arises from dietary habits or liver qi constraint. The treatment goals for TCM is going after the root causes, which addresses disturbances in qi circulation to treat seizures. The holistic approach is restoring the free flow of qi and balancing internal energies. Contrast with Western medicine, TCM targets holistic balance, not just the symptoms. TCM seeks to harmonize body energies and address the fundamental imbalances causing the seizures. So treating the root cause, not just the branch. All right, so when we talk about acupuncture and epilepsy management, there's some clinical studies that have been included. So one study talked about temporal lobe epilepsy, which acupuncture reduced seizures and improved quality of life. There was a meta-analysis review that shows acupuncture enhances the effective rate of Western treatment, improves quality of life, and reduces seizure frequency. And then there was the personalized acupuncture approach. Treatment is based on individual TCM diagnosis. Specific acupuncture points used in the studies that were provided were some of the points listed here. And then there's a chart here that kind of shows when these points are used. Outcomes of acupuncture and epilepsy management. There was a significant reduction in seizure frequency, notable improvements in quality of life for patients receiving acupuncture, potential as promising adjunctive therapy in epilepsy treatment. Chinese herbal medicine for epilepsy. So Chinese herbal medicine uses tailored herbal formulas based on seizure nature and TCM imbalances. Individual herbal formulations include being prescribed for acute heat-related seizures, which would be rapid cooling herbs, and then recurrent seizures, formulas that's going to disperse phlegm, extinguish wind, sedate yang, and clear heat. Adjustments for chronic management. These treatments evolve as seizures stabilize to enhance control and well-being. The formulas are adapted to the patient's constitution and underlying causes. And some examples of formulas are here on the right with this chart and gives the properties and actions based off of Chinese medicine theory. As far as efficacy and research, active ingredients in herbs like Acorus calamus and Peony radix alba show anticonvulsant effects, cognitive protection, and nervous system support. TCM herbs such as Radix blue pluri and Scutellaria bicalensis present pharmacological actions comparable to conventional antiepileptic drugs. But there's a need for rigorous research. So there's an emphasis on more robust random controlled trials to validate the efficacy and safety of Chinese medicine and epilepsy treatment. And this is a chart which may not be as clear to see, but it shows related functions and possible mechanisms of anti-epileptic herbs. So, one herb may have several different mechanisms associated with it. So these are a list of several different herbs, and it shows some of the Western scientific mechanisms that are shown in the research to show how these drugs are helping with epilepsy. So as far as the integrative approaches, combining Chinese herbal medicine with anti-epileptic drugs shows delayed development of drug resistance, increased efficacy of anti-epileptic drugs, and reduced side effects from anti-epileptic drugs. And one study here reports improved outcomes and reduced adverse effects. Mechanisms of synergistic effects. So it shows that this combination inhibits brain proteins associated with drug resistance, modulates neurotransmitter balance, reduces neuroinflammation via immunosuppressive actions. And this is another study right here associated with this that discusses the reversal of drug resistance. Challenges in herb drug interactions. Herbal complexities and individual responses pose assessment challenges. And this is another study included that showed the necessity of careful herb and drug interaction analysis. So the potential of integrative approaches, there's an offering that's showing promising avenues for better therapeutic results in epilepsy management, a call for individualized and cautious treatment planning, which here's another study that advocates for that integrative strategy, and advancing epilepsy care. The integrative approach marks a progressive step in epilepsy management, emphasizes the need for personalized care to ensure optimal efficacy and safety. More research, evidence, and methodology. So, acupuncture in Western medicine shows a reduction in seizure frequency and improvement in quality of life. As far as Chinese herbal medicine, tailored formulations target TCM patterns like internal wind and phlegm, have enhanced seizure control and reduced anti-epileptic side effects. Inclusion of random controlled trials in a range of study types such as systematic reviews, meta-analysis, and observational studies were used. There was a synthesis of evidence from 20 studies offering a broad range of evidence. And as far as the overview, combined therapies may delay resistance and enhance efficacy. As far as Chinese herbal medicine effects, there's a potential to inhibit drug-resistant proteins, modulate neurotransmitters, and reduce neuroinflammation. And here are more significant studies down, where one study here shows the benefits of Chinese medicine and anti-epileptic drug integration. Another study discusses the importance of addressing herb-drug interactions. And this study here talks about acupuncture reducing seizures and improving life quality. So the challenges and future direction. So one is overcoming research challenges in TCM. There's a need for more high quality studies to strengthen evidence, overcoming biases and heterogeneity in TCM literature, emphasizing randomized controlled trials to validate the efficacy. Some of the research limitations that's noted. Scarcity of rigorous random controlled trials evaluating acupuncture's efficacy, heterogeneity in study designs, treatment protocols, and outcome measures, geographical biases impacting the generalizability of findings. As far as the importance of high quality research, it ensures personalized and holistic treatment approaches, enhances understanding of acupuncture and TCM's role in epilepsy, informs evidence-based clinical guidelines for integrative care. So I believe the future research directions based off the research should address geographical biases and diversify study populations, employ stringent methodologies and long-term follow-up studies, focus on tailored TCM approaches for different seizure types. The goal for mainstream care should improve integration of traditional Chinese medicine and mainstream epilepsy management, advocate for interdisciplinary research and collaborative practice, elevate patient care through combined expertise, and traditional Chinese medicine and conventional medicine. So conclusions and implications. Basically is highlighting the holistic potential of TCM and acupuncture. Evidence from robust research supports their use in reducing seizure frequency and improving quality of life. There's definitely a major call for integration. So, utilizing evidence from high quality studies to shape the future treatment protocols, a multidisciplinary approach for personalized treatment strategies in epilepsy care, the need for rigorous research. So, there's an urgent need for more high quality randomized controlled trials and overcoming biases and heterogeneity in TCM research to ensure robust evidence. As far as future direction, addressing research challenges to validate and understand the mechanisms of TCM and approach in epilepsy management, promoting interdisciplinary collaborations between traditional Chinese medicine practitioners and neurologists. And final thoughts, by surmounting current research challenges and biases, TCM and acupuncture stand to offer valuable complementary therapies in epilepsy management with the promise of enhanced patient outcomes. So I've also included a case study here of a 24-year-old male with a history of chronic seizures since 2011. The symptoms presented were chest pain, headaches, depressive symptoms, cold extremities, disrupted sleep, dizziness, fatigue, nighttime seizures characterized by blank staring. The diagnosis was fire not ascending, also phlegm generating internal wind. The treatment duration, so this patient had been undergoing treatment for epilepsy for over a course of 8 sessions. So here are some acupuncture points used. These are some of the main points. These are some of the supporting points. Of course, these points kind of changed and were used based off of each visit when the patient visited. So they were kind of used, some used, some not, depending on the presentation of the patient. Some ear points, moxibustion. This was like one of the main herbal formulas used with one of the key herbs. Once again, though, at certain points of the treatment, formulas were changed and modified. So this was the positive outcome: improved sleep quality and reduced seizure frequency, faster recovery time after seizures, enhanced cognitive function, milder seizures were quicker with quicker resolution. So he was able to snap out of the seizure much quicker each time. The conclusion: after 8 sessions of combined acupuncture and herbal treatment, the patient experienced significant improvements in seizure control and quality of life, aligning with the epilepsy diagnosis. So the patient reported, emotions were much better. He wasn't feeling, depressive thoughts anymore, feeling like he had more energy. Seizures were less, and when he did have seizures, he was able to snap out of the seizures much quicker. And these are some references. So I would like to thank everyone for attending this presentation. I hope that it was very informative and how Chinese medicine, also integrated with Western medicine, can be of help with epilepsy. I know some people may have questions. If you do have any questions, feel free to reach out to me via email. I'll definitely get back to you with any questions you may have. Enjoy the rest of your day.